Have you ever really thought about what goes into making a perfect smile? It's way more than just the dentist's skill. Today, we're going to pull back the curtain on a material that's absolutely crucial, but almost nobody talks about: dental gypsum.
You know what I'm talking about, right? We've all been there. You're leaning back in the chair, and here comes this tray full of cold, kind of weird-feeling goop that gets smushed up against your teeth. It's an experience. But have you ever stopped to think, what happens to that perfect little mold of my mouth after I get up and leave? That's where the real journey begins. And that's the story we're diving into. Okay, so the whole process kicks off with this really cool transformation. To get it, you have to understand how we go from something called a negative to a positive. So what does that even mean? Let's get into it. That goopy stuff, its official name is an impression. And the phrase to lock in here is negative likeness. Just think of it like a mold. It's not a model of your teeth, it's a perfect reverse copy of them. And why on earth would you want a reverse copy? Well, the whole point of that negative impression is to create its exact opposite, a positive replica. The impression is the mold, and what you create from that mold, that's the main event. And that positive replica? That's called a cast. This is the thing we're after. It's the final 3D model of your mouth that a dentist or an orthodontist can actually hold in their hands, study, and use to figure out your treatment. So how do they get from that squishy, negative mold to the hard, positive cast? Well, the hero of our story is this amazing, super versatile material known as gypsum. Now, this is not just about pouring some plaster and hoping for the best. Oh no, there is some seriously elegant science happening here that turns a simple powder into a tool of unbelievable precision. Let's see how it works. You know, this quote from the source material just nails it. It starts out as this fine powder, you add water, and it becomes a liquid that can flow into every single tiny nook and cranny of that impression. And then it hardens into this solid, super stable, and incredibly accurate model. It really is a simple but totally critical four-step dance. You mix the powder and water, you pour that slushy mix into the negative impression we talked about, and then you just let chemistry do its thing as it hardens into that perfect, positive copy of your teeth. And that hardening process, it's not random at all. It is meticulously controlled. One of the most important properties is called setting time, the exact amount of time it takes to go from liquid to solid. And that's not just about being patient. It's about getting predictable, repeatable results, which in a busy dental lab is absolutely everything. Okay, now this is where it gets really interesting. It turns out gypsum isn't just a one-size-fits-all kind of deal. Dentists and lab techs have a whole toolkit of different gypsum products, and each one is designed for a very specific job. I mean, it makes sense, right? Making a simple study model just to show a patient their options has way different requirements than creating this super-duper accurate base you need to make a crown that fits perfectly. You gotta pick the right stone for the job. So let's look at the lineup. You start with type 2, which is your basic dental plaster. It's usually white, and it's great for those simple study models. Then you level up to the stronger stuff, type 3 dental stone, which is often that classic yellow color you see. That's perfect for things like orthodontic casts. And then, for the really demanding jobs where every tiny detail matters, you've got type 4, or high-strength stone. That super strong type 4 stone is what they use to create something called a die. Now, a die isn't a model of your whole mouth. It's an ultra-precise replica of just one single tooth that's been prepared for a crown. This is what the lab tech works on to make sure that new crown or bridge fits perfectly. So, this all begs the question, why gypsum? I mean, of all the materials in the entire world, what makes this one so perfectly suited for this incredibly detailed and important work? What kind of detail are we talking about here? Get ready for this. 20 micrometers. To give you some perspective, a single human hair is about 70 micrometers thick. So we are talking about capturing details that are less than a third of the width of one hair. That is just a mind-blowing level of detail. And that's what high-strength gypsum can do. When you're making a crown that needs to fit seamlessly against the tooth next to it, down to the micron, well, that kind of accuracy is everything. It really just comes down to this perfect checklist of properties. Gypsum is dimensionally stable, meaning it won't shrink or warp, which guarantees a perfect fit. It's strong, so it can handle the whole fabrication process. It captures those insane microscopic details we just talked about. On top of all that, it's biocompatible, so it's safe, and maybe craziest of all, it's cheap and easy to use. It's just the perfect material for the job.
So, when you tie it all together, you realize that this humble powder is the foundation for so much of modern dentistry. It's the absolute essential first step for creating pretty much every custom fit thing you can think of, from a simple retainer all the way up to a complex dental bridge.
So the next time you're at the dentist or the orthodontist and you see one of those yellow or white models sitting on a shelf, maybe you'll see it a little differently. Are you just going to see a piece of stone? Or are you going to see a tiny masterpiece of material science? The end of that amazing journey from negative to positive that makes your perfect smile possible.